Cancer was the third leading cause of death among Filipinos last year. Health experts say early detection and treatment can do wonders for patients. We'll learn about this group of diseases with Manuel Francisco Roxas of the Philippine College of Surgeons Cancer Commission. He joins us now from Cape Town, South Africa. Doc, thank you so much for joining us all the way from Cape Town. Share with us, what are the common cancer cases in the country?
Good evening, Nico. Well, cancer is second leading cause of death around the world, and around that figure also in the Philippines, depending on, of course, the COVID data as we look at it from retrospectively. But the top cancers in the country, the number one is breast cancer, followed by lung cancer, which is usually the number one, and then colorectal cancer. We have cervical cancer and liver cancer also being in the top. So the figures are pretty starking, Rico. Approximately 150 deaths a day in the country from cancer, and approximately 400 plus new diagnoses a day. And even in breast cancer, 1 in 9 Filipinas will get breast cancer. And if you have a classmate or the like, you can look at the statistics yourself as we grow older.
Yeah.
Exactly, 1 in 9 will get cancer.
So who are the people usually at risk of getting cancer, doctor? And of course, at this point, there's still no cure.
Well, no, that's not right. There's cure for some cancers, particularly if caught early. In fact, the more common cancers, if caught early, are curable. Okay, so that's the role for screening. If we can pick them up early at early stages, or even before they become cancer, then we prevent and cure cancers. But the trick here is having a whole of society approach so that we can pick them up earlier and offer effective treatment. No? There are also lifestyle changes that need to be done. For instance, smoking cessation, too much alcohol, sedentary lifestyles. But the biggest risk actually across the globe is just the mere fact that we age. And as our population ages, then the higher the incidence of cancer. So I'm here in South Africa for a conference on health, and we do project across the globe a real crisis in cancer epidemiology in the future because of the aging population across the globe.
So doctor, how accessible are cancer treatments in the Philippines?
Well, let me just say, Rico, we have one of the laws that was recently passed in 2019 called the National Integrated Comprehensive Cancer Act. And we have been cited by the WHO and many other countries for this law. And the law is supposed to upgrade our cancer facilities in both government and private, as well as provide funding for patients. The trick really is in implementing the law. So yes, the treatment is available. There are centers for cancer, but one of our goals also in the Cancer Commission is to improve quality of care as well as access. And that's something that's still a work in progress. There are a lot of challenges. And just because you have a radiotherapy machine in one hospital doesn't automatically mean it's running well. We do have to look at the processes and improve the quality of care across the spectrum of treatment modalities, because cancer is not easy to treat.
Yeah.
It requires a lot of modalities to treat.
And doctor, of course, you mentioned about improving the quality of care, but also on the flip side, many people also cannot afford the cost of cancer treatments.
Yes, that's true. And in fact, that's the other thing we need to look at, because aside from the toxicity of cancer itself, especially when late, there is financial toxicity, and we understand that many families are left bankrupt after cancer treatment because it's quite expensive, and that's why the law is there to try to provide more funding for hospitals, more funding for local governments to go into screening programs, and more funding for patients. PhilHealth also has some provisions for cancer. We call it the Z benefit for the common cancers, and it does provide an impact. But yes, there's a long way to go. which is why that's our challenge now, and which is why we're trying to organize everyone, all the stakeholders, to come
Yes.
together, discuss among
Of
ourselves
course.
how to improve cancer care throughout the country.
Of course, while stakeholders are discussing about the cost of cancer treatments and for cancer patients at the moment, what is the importance of family, friends, and support groups?
Well, I have to say, in this country, the cancer law was actually driven by cancer survivors and support groups, not by doctors or nurses. Their strength was really with the cancer survivors. So they saw the challenge, they saw the difficulties, and they really pushed Congress for the law. Clinically, you need, aside from your doctor, you need your relatives, your family members to be there for you, not just financially, but in terms of psychiatric, social support, and the like. So they go hand in hand, and without the help of families, particularly for childhood cancers, it would be very difficult to treat them.
Thank you so much for your insights on cancer. Philippine College of Surgeons Cancer Commission Chairman Manuel Francisco Roxas.